Ergonomic design is not trying to fit your environment, but making your environment fit you. It's harder to change yourself than it is to change the environment around you. And when you try to operate in an environment that isn't a good fit, you end up not only uncomfortable, but you put yourself at risk of injury. Neck and lower back pain, repetitive stress injuries, nerve impingement are just some examples. Once you understand the basic principles of ergonomic design, you will be able to make healthy changes to your environment and routines to prevent injury and disability while you continue engaging in the activities you love and enjoy for as long as possible. In addition to considering your environment, it's important to consider your work itself. Our bodies were not designed to keep doing the same motion over and over and over again, especially with the little tiny muscles, tendons, ligaments, and joints in our arms and hands. Continual repetitive motion over time can cause irritation, inflammation, swelling, and damage to these tendons and muscles. Your joints can wear down over time, causing the cushioning to thin and erode, resulting in pain as bones rub up against each other. Physiological and structural changes at this level can lead to impingement of nerves as well, which leads to tingling, numbness, and loss of sensation and function. These are what are known as repetitive stress injuries, musculoskeletal injuries caused by repetitive use over time. They include conditions like carpal tunnel, tendonitis, osteoarthritis, and DeQuervains. In short, carpal tunnel is impingement of the median nerve, which causes numbness, tingling, and loss of function on the radial or thumb side of the hand. Osteoarthritis is a degenerative joint disease caused by wear and tear on protective tissue at the ends of joints over time. Tendonitis is inflammation of tendons caused by overuse or injury and often affects the elbow, wrist, or fingers. And DeQuervains affects the tendons on the thumb side of the wrist. A survey was conducted with members of the UNH art department. 5 faculty members, 9 student art majors, and 1 student taking art as an elective were surveyed. The participants used materials including pencils and paint, photography, pottery, wood, ceramics, paper, metal, textiles, glass, graphic design, and stringed instruments as part of their craft. Participants were asked if they experienced pain, numbness, tingling, stiffness, or discomfort during or after engaging in their craft, and where this pain and discomfort occurred. 47% reported pain or discomfort at their wrists. 60% reported symptoms in their hands and fingers. 20% reported symptoms in their thumbs. 27% reported symptoms in their elbows and forearms. 27% reported symptoms in their shoulders. 33% reported symptoms in their neck. 27% reported upper back symptoms. 60% reported lower back symptoms. 20% reported symptoms in their hips. 40% reported symptoms in their knees, 13% reported symptoms in their ankles, and 40% reported symptoms in their feet. 60% report pain that interferes with their craft, 40% report pain that interferes with life activities, and 80% have received little to no education on proper positioning of their body or ergonomics during their craft. So what are the basics of ergonomics? These aren't hard and fast rules, but general guidelines that you should follow. You may find that your craft puts you in different positions where you'll have to modify and adapt to fit within the guidelines. So you can see how this bear has short little legs. He's not going to fit comfortably in the chair with his feet resting on the floor. But if you put some books underneath your feet, it brings your knees up and you can have a better position. When you think about ergonomics, think about Goldilocks. You want your joints to rest in a just right neutral position. So you want your back straight your head aligned over your shoulders, aligned over your hips. You want your knees and feet to be at about 90-degree angles, and as well as your hips and elbows. And you want your wrists in slight extension. What you don't want is for your wrists to be sustained in a position of flexion, so bent forward, or extension, bent up. This can happen when your table is too low or too high. And what this does is puts pressure on the transverse carpal ligament, which is like a little tunnel in your wrist where your median nerve and your tendons run through. And these postures can put pressure on those, causing things like carpal tunnel. You also want to make sure you're decreasing the amount of force you're using with your tools. You make sure you take breaks, avoid repetition, and again, maintain a good posture straight up and down. Repetitive stress injuries have a high cost. Time spent out of work, medical bills and rehabilitation, surgery, loss of a meaningful leisure activity which can impact mental health, of course, pain and discomfort, and also loss of sleep can all be cumulative costs of repetitive stress injuries and poor ergonomic positioning. Have you ever become so immersed in what you were doing that you lost all sense of time? This is what we call flow state. Complete immersion in an activity that brings enjoyment. It is a wonderful feeling, but lengthy amounts of time doing something over and over again, or sitting and standing in awkward positions, can lead to pain, discomfort, and injury. It is important that you take breaks every 20 minutes or so to change positions, stretch, and give your body a break. The most important thing you can do is listen to your body. If you are experiencing fatigue, discomfort, achiness, cramping, soreness, that's your body's warning that you need to stop. Sometimes we can get so immersed in a project or assignment, we block out these little warning signs until it's too late and we're already in pain. It may be helpful to set a timer, or you can put out a glass of water as a visual reminder to take a break and take a sip while you're at it. You can also set a goal. For example, I will finish this layer and then take a break. It doesn't have to be a long break. Get up, get a snack. Look out the window. Your eyes have lots of little muscles that may need a break too. Do some stretches. Do some deep breathing or meditation. Take a walk, even just around the room. Take a step back and look at your work from different angles. This may help you see the bigger picture and will give your hands a chance to rest. If you do get to the point where you're experiencing pain, stop. If pain, numbness, tingling persist, you may need to talk to your physician. It doesn't matter how young you are or how many years you have been engaged in your craft. It is never too early or too late to start thinking about taking care of your body. The kinder you are to your body now, the better it will serve you into the future. So I hope you will take these general principles, adapt them, be creative, and share your ideas with other artists too. Happy crafting!